so today I'm going to be showing how to take care of your braces after they go on. We are going to start by talking about brushing your teeth. So with braces, you will notice that you need to brush your teeth more frequently. That way they stay clean. Food will tend to get stuck underneath the wire and in between the brackets after meals and snacks, so you'll want to keep them clean afterward. Try and brush after breakfast, lunch, and dinner. If you want to brush after snacks and in between, definitely doesn't hurt to keep them even more clean and brush at those times as well. So we're going to start with a video here that's going to show you all of the areas that you'll need to keep clean. We always suggest using a soft toothbrush over your teeth and your braces. If you have an electric one at home, that is perfectly fine to use as well. You'll start with this circular motion over top of the teeth, touching on your gum line, and then over top of the braces. Next, we'll bring our brush into a sideways position here where we sweep along the bottom ledge of the braces, and then we'll sweep along the top, just making sure that there's nothing caught underneath and in between. Next, we'll move on to the area of our teeth where we do a lot of our chewing and eating. We'll make sure that those areas stay clean as well to prevent any cavities or decay while you have the braces. And behind our teeth, we always brush down and away from our gums. We don't want to brush up because that can push things into them. Of course, we'll brush our tongue as well. Very important to clean that as it can hold a lot of bacteria. The next tool that this video is going to show you, this here is called the proxy brush. So you'll find one of those in the kit that we give you. Just looks like this little Christmas tree brush here. For this, it fits in between the small areas between the brackets and underneath of the wire. So if you ever find that you're having a hard time getting anything out with your toothbrush, then you can use this into the smaller spaces. All right, so that's pretty much everything for brushing. The next thing we're going to look at here, this is going to go over flossing. So flossing can be quite a bit different when you have braces. Now you have a wire that's going across your teeth, so you need to work around that to be able to floss all the way up to your gum line. There's two different kinds of floss that we give you in your kit. We have regular string floss, which you can use along with a floss threader. Basically, the way that this one works is that you're going to take your floss, you're going to place it through this loop here, and you're going to pull it through almost like using a needle and thread. Once you have it like this, then you'll use this to go underneath of the wire, bring your floss underneath where the teeth are, and then you'll be able to work through. So I'll show you here on this model. You're going to take your floss threader just like that underneath of the wire. You're going to pull it through, and then once you have your floss underneath the wire there, you'll be able to bring it up in between the teeth. Once you finish, you'll just remove it, and then you'll move on to the next tooth, the next space. It will take more time to floss with braces, but don't let that discourage you. Give it time and you'll kind of get used to the motions of it. The other kind of floss that we give you, this here, it's called Super Floss. Comes in a little spool like this. So what this is here is basically a piece of floss that's already attached to a hardened tip. That tip works to help guide you underneath of the wire as well. So with this, I'll show you a video on how that works. As you can see, we have the same kind of floss there in the video. And like I said, that green tip is going to help guide you underneath of the wire. Once you have the floss underneath the wire, then you can place it all the way up to your gum line, work between the gums, and then once you've flossed the area in between there, then you'll just pull it right out. Move on to the next spot, and then so on and so forth. With flossing, you should do that once a day. Typically, suggest doing it before bedtime, just so that way, you don't go to sleep with anything in between your teeth. And typically, people have more time at night when they're settling in for nighttime. The last thing I'm going to show you here today, this is going to show you a video basically on what happens when we see bad oral hygiene with braces. When we remove everything at the end, this is ideally what we'd like to see. If we had a patient who struggled with oral hygiene through treatment, they weren't brushing after meals, they weren't flossing properly, oftentimes food was left over the teeth, which can cause bacteria, which can actually decalcify the enamel. So what that looks like on the teeth is white spots around where the braces are. And as you can see in the image here, there's this block shape here, which is where the brace actually was, and the white spot around where it was placed. So I'll hit play on that. So as you can see, over time, if you're neglecting your brushing, that bacteria will form around the braces from the foods we've been eating. And then when we go to take off the braces, we remove everything that was there. And then you see the spots like that. So we want to avoid that as much as possible in treatment. And the best way to do that is by brushing your teeth after every meal. You'll notice as well, the gums get very red, puffy, and irritated. So if you notice that your gums are looking that way, that means you have to brush along where the braces are more adequately. All right, the next thing that I'm going to show you here is how to use the dental wax. So dental wax comes in a little case that looks like this. You'll find that in your kit as well. What this is used for is basically in case there's anything that's sharp, pinching, or poking you along your braces, you can place the wax over top. Over the first couple days with the braces, it may take some time for your lips and cheeks to get used to the feeling of everything. So if you find that you're getting a little bit of a sore or an irritation along your lips or your cheeks, you'll place wax over top of where it's bothering you. So I'll show you how that works. Basically, you'll just take a small piece of wax from the kit there. You're gonna ball it up. And then if you have a brace that's bothering you on the side here, you're just gonna place that right over top just like this. It'll create a soft, smooth area. That way it doesn't continue to rub and irritate your lips or cheeks. Sometimes as well, as the teeth move and start to align the teeth, the wires can get a little bit long on the back end here. So if you find that you have a pokey wire on the back, it can be helpful to place wax over top. If it doesn't help you, of course, give us a call, let us know, and then we'll have you come on and we can fix it for you. Okay. I'm trying to think if there's anything else I really need to show them. I guess I'll talk about like the first couple days with braces. So over the first couple days with your braces, your teeth might be a little bit sore. That is normal to feel the pressure of the wire working on your teeth. If that discomfort is really bothering you, typically we suggest Tylenol or Advil for the pain and sticking to a soft food diet. So foods that don't require too much chewing. Through treatment, avoid anything really hard, sticky, or chewy. Sticky and chewy foods, they can make a mess in the braces, which make them difficult to clean. And foods that might be a little bit too hard, they can break the wires or the braces. So you want to avoid things like that. Fruits and vegetables, we do suggest that you cut those up into slices, as biting into an apple can definitely break the braces off, but cutting it into slices would be more than okay. Okay, so if you have an emergency, if there's something broken or bothering you has come loose on the braces, of course, give us a call. Let us know to the best of your ability what it is that's going on. That way we can make an appointment for you to come in and then we can see you and then fix that. That way everything can go back on track and then we can get the braces back to where they need to be.